Hi, my name is Dr. Tenesha Wards with Infinity Wellness Center, and I'm going to go over with you our essential lab package, our silver option, which is the starting point for most patients who come to us with fatigue. So we have 5 tests that I really like to look at when someone's suffering from fatigue, starting with our functional blood chemistry. This is similar to what you might get done at an annual exam, but a lot more thorough. There's 55 blood lab markers that we're looking at here, and how we read it is a bit different. So the lab gives us a range from here to here. That's a pathological range. Okay, if something's out of that range, it's a pathology or a synonym for disease. We're looking at a functional range, which is a much tighter range. So we're going to address low normals and high normals. So that's part of it. But then again, we're running a lot more markers, and I'll go into those in just a second in a little more detail. Next, we look at the stool test. So nothing else matters if your gut's not absorbing your micronutrients. Really, nothing else matters. And almost all healing starts in the gut. You've probably seen these yogurt commercials that say 80% of your immune system is in your gut. That's 100% true. So this test tells us if there's any bad bacteria, fungus, parasites, things like that could be breaking down your gut lining. But also, it tells us if you are deficient in low levels in any good bacteria, which can matter. So this will rule out things like leaky gut. And again, we often have to start here to make sure you're absorbing to fix anything else. Then we go into the hormone panel. I like to see hormones in saliva for 2 reasons. One, you can take multiple samples throughout the month. So I can see if the hormones are rising and falling like they should, versus one blood lab and one day, and it only gives us a portion, a section of what's going on with a whole 28-day cycle. But also, in the blood, hormones can be bound to a protein, and they're not bioavailable. So the saliva is a little more accurate on what we can actually use as far as our hormones. Then the 4th test is our genetic MTHFR gene test. This tells us if you're a poor detoxer, which can absolutely be a big culprit for fatigue. But also, this goes over your mitochondrial pathway, which tells us how well you make ATP, which is, the powerhouse of the cell is the mitochondria, and ATP is our energy source. So if you have a genetic defect where you're not making ATP properly, you will absolutely have fatigue. And there's a lot we can do with the genetics to help fill in the gaps of this pathway so you can make energy. And last test is our functional brain chemical test, so our neurotransmitters. So we're looking at serotonin, dopamine, GABA, epinephrine, norepinephrine. So we're looking at the brain chemicals, which can absolutely matter with fatigue, low mood, anxiety, insomnia. But we're also looking at the adrenal glands a bit and their function with epinephrine, norepinephrine, and see if you're kind of in a state of adrenal fatigue or burnout. So this is a really comprehensive look. I like to say it's kind of like lifting the hood when you see the check engine soon light on and seeing what's going on inside. Where's our starting point specific for you? So now I'm going to dig in a little bit of a deeper look into what blood markers we look at. So I'm going to stop sharing this, and then I'm going to share my screen here and take a look at the actual blood markers that we use and that we're testing for. Okay, so our functional blood chemistry, again, is a pretty extensive lab test. Some of the basic stuff, CBC, differential with platelet count. Okay, so we're looking at white blood cells, red blood cells, hemoglobin, hematocrit. But again, we're looking at a much tighter range. So your white blood cells may be barely out of range, and that could indicate that you have a chronic infection, and that would lead us to dig deeper. We also look at a liver panel. So how well is your liver working? GGT could tell us if you're having gallstone issues. This can, again, kind of line up with, are you a poor detoxer? Is the liver stressed? We look at a lipid panel, which is cholesterol, HDL, LDL. That's pretty standard. And then the thyroid panel. So most annual tests, most doctors stop at the TSH, the thyroid stimulating hormone. This really only tells us the function of the pituitary gland in the brain, okay? The pituitary gland in the brain produces the TSH, or the thyroid stimulating hormone, which stimulates the thyroid to make T3 and T4. So without the T3 and the T4 and the free T3 and the free T4 and the T3 and T4 uptake, we really don't know what the thyroid is doing. The TSH could look fine, but the T3 and the T4 are low, and that matters. So we have to look at the whole picture of the thyroid. And again, 80–90% of the time, only the TSH is being run, which is a complete miss as far as I'm concerned of a whole picture of the thyroid. And then we also look at the thyroid antibodies. So meaning, is there an autoimmune disorder? Is your body attacking its own thyroid? Does your body think that your thyroid is public enemy number one and it's attacking it? That matters because that is a completely different approach to the thyroid than hypothyroidism is. So we need to know that. We need to know if there's an autoimmune pattern in the thyroid, which is a huge culprit for fatigue. Then we do a comprehensive metabolic panel. This has blood sugar, hemoglobin A1C. We're ruling things out like diabetes, low blood sugar, insulin resistance. We're looking at a lot of the minerals, sodium, potassium, magnesium, but we look at them differently. So if the sodium potassium is high, we know that the adrenal glands that sit on top of the kidneys in the back have these tiny little sodium potassium pumps on top of them. And if it's high, the sodium potassium is pumping out a lot, going in and coming out, your adrenals are stressed. We know if it's low, they're depleted. So again, we're really looking at the body from a different perspective, through a different lens. And then of course, we look at things like iron for anemia, ferritin. Sometimes we need to know your blood type. That helps us help you better. Certain foods and herbs do better with certain blood types. And then this little section here, we're looking at your inflammatory markers. A lot of the time this is missed. Homocysteine and C-reactive protein, very high sensitivity on those. So is there inflammation in your nervous system? Is it affecting your heart? Is inflammation a culprit? And then how can we find out what's causing the inflammation? Of course, is what we do. But we need to know, is your body inflamed? Is that a starting point? Vitamin D. I think vitamin D is becoming more and more common to run, but that's a huge culprit for fatigue. It's a huge antioxidant, so we need to know that level. We like to see it between 60 and 100. Western medicine considers anything 30 to 100 okay. I still find people are fatigued when their vitamin D is at 30, 40. And then lastly, Epstein-Barr Virus, EBV. We look at IgG and IgM. Is this a new infection or a flare-up of an old infection of Epstein-Barr virus? And the number one symptom for Epstein-Barr virus, if you have Epstein-Barr virus, is fatigue. So we're going to dig deep in that whole blood panel, how we look at the blood. We don't leave any stone unturned trying to figure out what's causing your fatigue. So if you have any questions, let us know. Hopefully this has been helpful. And I look forward to uncovering your case with you.